Okay, we are live now. Hi guys. So we are going to start the interview in 5 minutes, but I'm here with Shane. Shane is our T5 patient from USA, and he's here with us to answer a few questions about the treatment, about how is he doing before and after the treatment, because he's almost done with the treatment here at Mexico. And we're going to answer some questions about everything of the treatment and if you're a candidate or not and all that kind of questions. So wait for us 5 minutes more, please. Hola, estamos en vivo con Shane. Es un paciente T5 de Estados Unidos que nos acompaña aquí para platicar un poquito del tratamiento que hicimos de lesión medular con él y responder un poco de dudas de si soy candidato, si no, si mi lesión tiene tanto tiempo. Todo eso nos pueden preguntar y les vamos a estar contestando. El live es en inglés, pero también voy a contestar algunas preguntas en español. Shane habla un poco español.
Sí, un poco.
Entonces puede contestar también algunas de las preguntas que tenemos en español. ¿Y dónde vemos? Ahí vi un high. ¿Dónde vemos cuánto?
Ahorita 14.
Ok.
En Instagram 14.
¿Y en Facebook? Es Facebook es ese, ¿no?
Sí.
¿Y dónde veo cuántos?
¿Cuántos?
Y están conectados.
Es que esa es la marcada.
Y en el mío. En el mío no sé dónde ver cuántos, pero. Ahorita vamos a empezar en unos minutitos. En el mío hay 8.
Acá en Instagram 12. Tu Facebook.
Sí, el Facebook es aquí.
Hola, Kevin. Ahorita ya estamos por iniciar en un par de minutitos, ¿sale? We're going to start in a few minutes with the questions with Shane. Are you ready, Shane?
Yeah.
Yeah. I am too. Okay. Yes, almost. We're waiting a little bit more to more people to join. Ok, ya casi estamos listos, espérenos unos minutitos más. Como les digo, va a ser en inglés, pero si tienen preguntas en español también las vamos a contestar, ¿ok? Shane está con nosotros desde finales de mayo trabajando con su lesión medular. Tuvo una lesión medular T5 en 2023.
Sí.
En 2023 y ahorita nos va a platicar un poquito de su lesión, de qué podía hacer antes de la lesión, antes del tratamiento, perdón, y después del tratamiento. So we're going to talk about the injury and what he was able to do before the treatment and after the treatment and everything that you have questions. Shane is here for to answer the questions, but me too, to answer some medical questions, okay? Bueno, pues ya, ok.
2 minutitos. We have 14 people in Instagram. Se conectará ahora.
Siempre se conectan hasta más tarde.
20.
¿Qué estás?
Instagram.
1 minuto, ¿no? Okay, 1 more minute, guy.
¿Qué estás en Epidural? Facebook está súper atrasado.
Muy bien, entonces yo creo que ya vamos a empezar. If you have any questions, please let us know. We're going to start. I'm Dr. Paulina from Verita Neuro. I'm the medical consultant at the clinic in Mexico, and I'm with Shane, one of our patients. So why don't you introduce yourself a little bit?
Yeah. My name is Shane Callahan. I'm from the United States, and I have a T5 incomplete spinal cord injury.
Okay, Shane, can you share us a little bit of your condition before the treatment?
Sure, before the treatment, I have limited sensation in my abdomen and legs, limited movement in my hips and glutes, and a tiny bit of movement in my toes.
Okay, can you tell the people a little bit about your injury? How was it? When was it?
Sure.
Like everything you can share.
My injury was from a car accident on October 7th, 2023. I was at Shirley Ryan Ability Lab in Chicago for 2 months, and then I went home and I've been going to physical therapy, trying to recover ever since.
Okay, and how was your recovery? Like, I mean, before this treatment, how was your recovery after the treatment?
My recovery has been slow. Shortly after my injury, I developed heterotopic ossification in both my hips. Should I explain?
Yes, you can explain a little bit if you want.
So heterotopic ossification is an abnormal amount of bone growth. So in my hips, there was an abnormal amount of bone, and it really limited and restricted my movement and my flexion of my hips. So it required surgery in both hips, and that really slowed down my progress.
Okay, Shane. What were some of the biggest challenges you faced early on?
Some of the biggest challenges were relearning how to do everything, things like getting dressed, daily tasks like using the bathroom, showering, and then just learning how to maneuver in a wheelchair. Also, as I just mentioned, the heterotopic ossification really limited everything, and that was a big challenge early on.
Okay. How did you first hear about us, about the treatment, and what made you decide to try it?
I first heard about Verita Neuro just doing some research, looking for alternative treatment options. At this point, I pretty much tried everything, and it just seemed like a good option to try.
Okay. Can you explain everyone what is a typical day at Verita Neuro? I mean, since you arrived, how was everything when we do the admission and everything?
My typical day here is I start physical therapy at 9 a.m. With the mapping therapist. So that's using the epidural stimulator and using it with exercises and activities from 9 to 11. And then I have a break for 1 hour. And then I have a physical therapy session from 12 to 1. And then another break. And then another mapping session from 2 to 4 p.m.
Okay, so before we keep doing the questions, I'm gonna explain a little bit about what we do with Shane. Shane, as you already hear, is a T5 spinal cord injury incomplete patient. When he gets here, the first we do is blood test and EKG, like all kind of tests to see if he's ready to the surgery. And he went undergone an epidural stimulation treatment, a lumbar epidural stimulator, which helped him to regain some movements below the injury, I mean the legs, like voluntary movements, which he doesn't have after the injury. So he was in a pretty good shape, and that helps a lot. And it's really important for me to tell you that if you are a patient who wants to do the treatment, it's really important for you to be in a good shape and do a lot of therapy before coming, because it's really a lot of hours of physical therapy and mapping, and some of the patients are not prepared for the treatment. So the successful of the treatment with Shane mostly was because of him, because he was in a really good shape and he can make like all the therapies and all the treatment because he was prepared. So we make a neurosurgery, which is an implantation of an electrode, and that electrodes help to improve like the signal that passed to your brain, to your legs, and makes it to make voluntary movements, like big muscle groups helps to make the contractions from quadriceps to do the standing training or to do the stepping training. But it's also important to know for you because it's a question that I have a lot. That is not a cure for spinal cord injury, but it helps Shane and the patients in general to improve the quality of life, to stand, to do some stepping training, flexing and extending knees, hips, and everything to activate all the muscles and improve the muscle tone. So it was really good for him, as I say, that he was in a really good shape. It's not for all the patients, but it doesn't matter if it's a complete or incomplete injury. You can be a candidate. So we're gonna keep talking about it, but I just want to say that he went undergone to a epidural stimulation surgery and get implanted a lumbar stimulator. Okay. So, what were your treatment expectations like before coming?
I didn't have any expectations. I set the bar pretty low, just to come here and try my best during all the physical therapy sessions, and just to see what effect the stimulator and the therapy and the stem cells would have in my recovery.
Okay. And how soon after the surgery you start seeing like some improvements or changes?
There haven't been any major improvements. There's been minor improvements where through using the stimulator with certain activities like standing and crawling and core work, things have improved, where it's easier to stand up, it's easier to crawl, it's easier to do certain movements and exercises that were difficult for me before.
So can you say before like you can stand but not like right now with the stimulator, like you can?
I'm not able to stand on my own.
Mm-hmm.
I need help from a physical therapist to lock out my knees,
Mm-hmm.
but the stimulator makes it easier for me to lock out my knees on my own, to control my pelvis and hips, and just to have more balance.
Were there any moments during your treatment that surprised you, either physically or emotional?
I think just repeating movements over and over again with the stimulator and then seeing them progressively get easier and better. So things like crawling have really improved. Even when the stimulator's not on, it's gotten better. So that has been surprising, as well as standing, where it just feels better. It feels stronger.
So what do you think is your biggest achievement so far?
That's a good question. I'm not sure. You know, I think I still need a lot more practice
Mm-hmm.
with standing and walking and crawling and things like that. So I guess I don't have an answer yet.
Okay, great. Have you received any treatments before Verita Neuro, and how those treatments were like different from this
Mhm.
one?
No, I haven't received any treatment besides physical therapy. I go to a clinic in the suburbs of Chicago called Next Steps, and they're great. They're awesome. And so while there, I've been using a device called ArcX. It's from a company called Onward in Switzerland. And it's an external spinal cord stimulator. So that's pretty much the only treatment I've received, and doing that with activities like walking and standing and crawling. But yeah, it's, I guess the difference is this stimulator is inside my body. And so it feels a lot different, and it helps. I think it actually probably helps more.
Okay, so talking about the stimulator is inside your body, it's a really common question that the people ask is you can feel like that you have the stimulator, or you can feel the battery, or if it hurts or something.
No, I don't feel any pain below my level of injury, so I don't feel. I guess it doesn't hurt. It doesn't hurt at all. I can feel when the stimulator is on. There's no discomfort or anything. But yeah.
Okay. How was your mindset changed from the early days of injury to where you are now?
I think early on in my injury, the focus from the physical therapist was more about comfort and acceptance rather than working to recover. So it's been a really good shift in my mindset to try to recover and try to regain sensation and movement and body functions that I used to have. So yeah, I think that's just been a major shift.
Okay, so we have a question here from Axel Marquez. Is it permanent or it can be removed once it achieves to walk? Okay, so this is a really important question because as I told you before, this is not a cure. So of course, we have patients who make like a stepping with some help, I mean a walker or something like that. But right now, the first improvement that you're gonna see is not walking. So we are not talking about removing the stimulator after walking. It is not permanent either. If you want to take it away after a few years, you can do it. Actually, we have some patients that with the stimulator off have some movements that only they can do it with the stimulator on. But that doesn't mean that they can walk by themselves. But of course, we have patients who have walk with a walker or with help. But it can be removed if that was the question. And we have a battery which have like 8 or 10 years of life, and after that we can change, but it's only the battery, it's not all the surgery again. Okay, so we're gonna do all. What's the next question? Okay. What is the potential outcomes that Shane can further achieve if continuing physical therapy? Okay, this is a question for me.
Yeah.
I think so. Okay, so as I was saying, he's in a really good shape, so that helped a lot because he had a lot of strong control. His strong control improved a lot, but also he already had it, so that helped a lot. So with Shane, I think he need more training. We recommend at least 1 year of training using the stimulator 5 times weekly. I'm sorry. But with a lot of training, I think he can make a few steps with a walker. I think he can achieve that. Of course, if he do more, I will be glad. But that's the most common achievements with a patient with his condition. Also, we are expecting improvements in bowel and bladder. Right now, it's really soon to talk about it, but we also did a stem cell treatment. And the stem cells helps a lot with bowel and bladder function. He's an incomplete injury. He already have sacral sensitivity and all the stuff, so that helps. But it could improve, and it could help him to control better bowel and bladder, because right now he's doing an intermittent catheter, and he has a bowel program which works great for him. But it could improve, but we need more months to see how it works. Okay. Frenzel, C4, C5 injury, can walk, no sensation below my chest. Can it help for incontinence and sexual dysfunction? No. This stimulator, it's only for movement. It's for motor function. It's not helping for sexual function. So if you have, we need to see your case of how many years after the injury we're talking about. But for bowel and bladder function, we will talk about more stem cell treatment than epidural stimulation, because it's more for motor function. Cristi Navarro, ¿cuál es la antigüedad de la lesión más vieja que han tratado con estimulación epidural? Hemos tenido pacientes de hasta 20 años de lesión. Entonces, el hecho de que tengan más de 10 años, más de 15, no significa que no sean candidatos. Hay que valorar su caso. Les pedimos una resonancia, hacemos una valoración previa, pero sí hemos tenido pacientes de 1 año de lesión hasta 20 años de lesión. Baby Bear. Is it possible to get in touch with someone who is already a user for an ES? Yes, we can ask some of the patients. Of course, we cannot give you the phone, but we can talk to some patients. Even if they want, they can talk to you to see what about it. Okay. Hello, Shane and Dr. Paulina. Sending greetings from Bangkok. I'm sorry, that's bad. Does it mean he needs to stay 1 year with you? No. That means that he needs. You don't want to stay with you?
I would love to, but yeah.
Why not? No. So we make the discharge. We give him some booklets and some information to him to keep working at home. But he will go back home on Sunday, and then he will keep working with his physical therapy and everything, but using the stimulator, and that will help to improve the programs and to see more improvements. Do you have any discomfort or side effects from the treatment, Shane?
No discomfort, no side effects. I will say when I first received the stem cell treatment, because it's an injection in the intrathecal, right?
Intrathecal, yes.
Space, I did have a headache later that day, but it went away after a few hours.
Okay. Hi, Jane. Shane.
It's my
Jane.
Hi, Antia.
Okay, I'm gonna give the question. So, what do you want to say to others who are newly injured and maybe feeling hopeless?
I'm not very inspirational, but to anyone who's been injured, I would say, don't lose hope. There's always hope, and just try everything. Work every day. Think about moving. Think about feeling, and just don't give up. That's probably the only advice I could give. That's simple.
That's great. It's simple, but it's great. Okay, so we're gonna wait for more questions. If you want to get in touch, we're gonna put a link on there so you can get in touch with some of our people of. Hello. Do we have more patients? ¿No? Si tenemos alguna pregunta en español, podemos contestar también preguntas en español. Una pregunta muy frecuente que nos hacen es si importa si es una lesión incompleta o completa. Realmente no importa. Hemos tratado pacientes tanto de lesiones completas como incompletas. En este caso, Shane es incompleta, pero hay pacientes que son completos y han tenido buenos resultados. Los resultados también dependen de cómo esté el paciente antes del tratamiento. Y de también destacar que no es un tratamiento milagroso que vienes y ya. Hay que trabajar mucho antes de venir y cuando te vas hay que seguir trabajando para tener los resultados. No, eso no. Ok, ¿algo más? ¿Dónde estamos ubicados? Laura, estamos ubicados en Guadalajara, México y en Bangkok. Tenemos 2 sucursales, nosotros ahorita estamos en México y es la sucursal en la que estamos en este momento. Any more questions for Shane? For me? For anyone? Anyone there?
Yeah.
Okay, entonces, ya. Okay. We're going to talk a little bit of how much days you need to be here to complete all the protocol of the treatment, because that's also a common question. So with Shane, he was a lumbar epidural stimulator, so he needs to be here 35 days. The first 10 days are at the hospital because we have an IV and some antibiotics to prevent infections. We make the surgery. But after 48 hours from the surgery, we start with the mapping, which is the process to program the stimulator to make the voluntary muscle contraction and to make all the other movements like standing, stepping, trunk control, and everything. But mostly it's 35 days, 4 or 5 hours of work like every day. And after the 35 days, you will take home with some videos and booklet and information so you can keep working at home. And if you need 2 stimulators, some of the cervical patients which doesn't have any movement in the upper body needs 2 stimulators. So 2 stimulators treatment is 50 days of treatment. Hay cosas, Alex, hay cosas que no se puedan hacer al tener el estimulador, alguna restricción. Realmente no, Alex. El estimulador está, como estaba platicando Shane, está por dentro, se coloca por medio de una neurocirugía. Entonces, tú no tienes nada por fuera de cables ni nada que te limiten. De hecho, te puedes meter a la alberca, puedes hacer todas las actividades normales. El estimulador tiene un cargador que lo utilizas nada más para estarlo cargando cada día, cada 2 días, depende del uso que le des. Pero fuera de eso no tiene absolutamente ninguna restricción. De hecho, es compatible con MRI. Entonces lo puedes poner en modo MRI, te pueden tomar resonancias, tomografías, todo sin ningún problema. What else? Axel asked if there's any restriction after the epidural stimulation treatment, but there is no restriction. Like you can use it in a pool, you can shower, you can do anything. You can also do MRI scan. There is a mood MRI, is compatible with MRI, so there is no restriction after the epidural stimulator. How soon after the surgery do you notice it changes? That's for you.
That's for me. Right away. Once the stimulator was on, it really worked to contract muscles that haven't contracted in a while. So muscles like my quadriceps, hamstrings, glutes, abdomen, the muscles in my lower back. So that was right away. Once they turned the stimulator on, those muscles that they were targeting were activated.
Ok, thank you. Entonces le preguntaron a Shane que qué tan pronto después de la cirugía vio resultados. Lo que estamos platicando es que inmediatamente después de la cirugía, cuando prendemos el estimulador, se empiezan a ver los resultados, ya que empieza la activación de los grupos musculares y él empezó a activar cuádriceps, isquiotibiales, abdomen, todo eso inmediatamente al momento de prenderlo, pero obviamente se tuvo que hacer una programación por 35 días para llegar a lograr ya movimientos más complejos. How does it work on all the injuries? Same as in new injuries. We're gonna evaluate the case. We need an MRI to see if you are a candidate for a stimulator. But once we say you are a candidate, it's the same function. Like we only turn on the stimulator and it helps to improve the signal that is already passing, because even if you are old injury, you may have some signal passing. If you have spasms or neuropathic pain, that means clinically that you have some signal passing through. So it only helps to improve the signal to make able the muscles to contract. So it works the same. How are you doing?
That might be for you.
No,
Is it for me?
I don't know.
You have to reply.
Oh.
We're fine, thank you.
Yeah, we're good. Thank you.
My boss has a spinal cord injury, me lo viste. I'm also interested on the work program. No, esa no. Are stem cells part of the treatment, or it depends? Regularly, they are part of the treatment. Most of the patients receive stem cells and also the epidural stimulator. But if your injury is too old, I mean more than 10 or 15 years, we maybe don't try the stem cells, because the stem cell will work more in patients with acute, or not exactly acute, but like new injuries, like 1 to 5 years. I do have patients with 10 years of injury which have stem cells. It helps to improve bowel and bladder, as I said before, but it's part of the treatment most of the times. It depends. Hola, doctora. Hola, G. Velázquez. Okay. Does this really work for a complete injury? Yes. As I said before, not all the patients are candidates, so we need to evaluate your case. You need an MRI for that, or a CT scan. It depends on what kind of injury you have. It doesn't matter if it's complete or incomplete. And also sometimes the patient thinks that they are complete and they are not complete. So you should have the H score to see if you are complete or incomplete. It doesn't matter on the MRI, but yes, we can work with both kind of injuries. Ok, so la pregunta que me hicieron ahorita fue si importaba si es lesión completa o incompleta. No importa si es lesión completa o incompleta, hay que valorar cada caso. Por eso siempre les pido que me manden su resonancia para poder valorar si son candidatos o no. Y una vez que me mandan la resonancia, se hace una consulta y se habla de las expectativas del tratamiento, ya que no todos los pacientes tienen las mismas expectativas de tratamiento. También es algo importante de mencionar. Mi jefe ya obtuvo un tratamiento de células madres y es candidata para el tratamiento. ¿Debería repetir el tratamiento de células? Depende, Laura. normalmente lo que hacemos con el tratamiento de células madre es revalorar 6 meses después para ver qué tanta mejoría tuvo, y si tuvo mejoría, a veces no es la mejoría que el paciente espera, como les digo, porque el paciente yo sé que espera una mejoría de pararme y caminar, no es eso, pero mejoran en sensibilidad, en vejiga, en intestino, a lo mejor en un poquito el tono muscular. Si tuvo mejoría, sí es candidato a repetir el tratamiento de células madre y se recomienda. Si no tuvo mejoría, normalmente no lo repetimos. Ok, tenemos más preguntas. Do we have any more questions? Baby Bear, if we share the latest MRI results, do you have a way to evaluate who qualifies? What about Asia A? It doesn't matter if it's Asia A. As I say, Asia A is a complete injury, but it doesn't matter. We can evaluate. We need you to send us the MRI, and after that we will do a consultation. And in the consultation, we will see how the patient is clinically, and if he's a candidate for epidural stimulator treatment or other treatments, because we also work with stem cell treatment and physical therapy, which is neurotherapy. It's mostly different from what you regularly do at the US. It's another approachment. So we have different treatments that you can try. It's not like only epidural stimulation for every patient. Okay. Yeah? ¿Sí? Okay. Thank you, everyone. We're going to finish with this webinar right now. If you have any questions, please let us know. You have all our channels, Epidural Stimulation Now. We have YouTube, we have Instagram, so you can join and follow us on everything and ask all questions. And thank you. Thank you, Shane.
Yeah. Thank you, everybody.
Muchas gracias a todos. Ya nos vamos, ya contestamos todas las preguntas. Si tienen más preguntas, por favor, a ver, aquí tengo otra. Esta es de mi TikTok. Me pueden seguir como doctora Pau Marín. Estoy en TikTok, en vivo también. Dice a mi hermano, ay Dios, ¿cómo le pongo? Aquí está. A mi hermano que dice, ya no va a volver a caminar, pero en Costa Rica no hay tratamiento para eso. Habría que valorar el caso, Chris Design. Como te comento, el tratamiento no es una cura para que vuelvan a caminar, pero sí mejoran mucho sus funciones. Los pacientes han llegado a parar y bloquear rodillas, a dar pasos con asistencia. Entonces podríamos valorar el caso para ver si el paciente es candidato.
Let's see.
That's for you.
Axel, thank you for your question. Yes, I can move my fingers and my hands. I have full function in my hands and my arms. The injury affects about the level here down. And Jennifer, originally I did feel tired. Thank you for your question. The stimulator is a lot because it activates muscles that haven't been activated in a while. So that even though I may not feel that my legs and my muscles are tired, they are.
Ok, thank you. Chris Design, te puedo mandar la información me puedes mandar la información. Aquí en mis redes sociales está mi número de celular, está mi email. Me puedes mandar toda la información. Estoy como doctora Pau Marín en TikTok o Pau Marín Epidural Stimulation en Instagram. So you can send all the information to our social media. I'm like Pau Marín Epidural Stimulation. You want to say your social media? No?
I don't have any.
So Shane has no social media. Okay. Getting for votes. I have a C6 and I found Verita, so I hope you can see soon today. Okay, Axel. See you soon. We hope see you soon. Can a C5, C7 tetraplegic patient, I hope, apply? Maybe?
Maybe.
Okay, yes. Actually, that are the most common injuries, the C5, C6. Yes. So yes, he can apply for the treatment and for a lot of treatments, not only epidural stimulation. Mm. Chase, Brad, Sean, FMX. Oh my god. What's your end goal with this stimulator? Do you guys ever see the technology improving? We think so. We think so. The technology is going to improve. It's been improving in the years, and we don't know if maybe in some years we have anything else or a cure. But right now, it's the most innovative technology that we have. But also, everything is improving. We don't know. Maybe some years you will take out the stimulator and have something to cure the spinal cord injury. Okay, thank you guys. Thank you everyone. Muchas gracias.
Sí, muchas gracias a todos.
He learned Spanish in Verita also.
Yeah.
Okay, thank you everyone.